right now, I have really leaned into exploration of having this huge, not huge, but having like a strong background in public health, theory and practice, and thinking of how to synthesize that into art making. And I'm gonna parse that out a little bit more into data and specifically um, thinking of methodologies and how different public health methodologies can go into art making and how art making itself is qualitative research and is a methodology or what I'm doing. Like I'm very stringent or like rigorous in my note taking and my documentation of my work, coming from again a public health like procedural background, and I'm also thinking really broadly about systems and specifically about Blackness, about race and ethnicity. And that's what something that was really sparked for me at my past job, thinking about how we are categorizing people and the implications that it has on every facet of life.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 81. Hi everyone, Omari Richards here. Be sure to follow me on Instagram if you have not as yet, at the PH Millennial. Be sure to subscribe to this, to leave a review, to leave a like if you're watching this on YouTube, to share it with a friend. Like that's the least that you can do if you've listened to any of these episodes and they brought you value. I would greatly appreciate any of those. And if you want to support even further, you can go to buymeacoffee.com/the PH Millennial or the phmillennial.com/support. This person today, very unique story, very different from any other episode that I've had before. Love the transparency, as well as if you want to purchase any of his art, there is a link in the description to his website. He has more art. Reach out to him on whatever social platform and help him out if this is interesting. This is very fascinating to me, and I'm glad that I got to connect with him because I think this combination of public health and art is fascinating all in itself. But I would leave you all to enjoy this episode, so enjoy. Today we have a public health practitioner of art and public health. He's motivated by the past to achieve improvements in education and health equity through true multimodal and inclusive approaches to public health and art. He got his bachelor's degree in family science at the University of Maryland, College Park. He then went on to get his Master of Public Health at Brown School of Washington University in St. Louis. He is currently working towards his Master of Fine Arts at the University of Illinois, Chicago. We have Derek Holland, MPH MFA candidate. Welcome to the show.
Thank you for having me.
It is my pleasure. We connected in a very random way, but I think that your story in itself, I'm interested just to dig into more of that because it's not something that I think I've heard a lot of, the mix of like public health and art. So I'm looking forward to all of that coming from you. So tell me how you doing and then how you've been coping during the pandemic.
I'm okay. I'm okay now. It's definitely been some deep downs and some better ups, but I'm good. I've gotten into like a rhythm. I just started my MFA this semester, so that's been a huge culture shock for me, and it's been in a good way a culture change. So I think I'm generally okay.
Hey, tell me more about that. What has been the good culture shock change that you've experienced?
Yeah. So I've been learning and working in some sort of public health space since I started undergrad. And I actually was like about 10 years ago. And now I'm have shifted into like this very like art world place, different language, completely different language, completely different just like operationalization of academia and of academia and a different, just a general different like culture of even how you move in academia. I've worked, like I said, in specifically, I guess, in public health spaces for the past, yeah, I started school in 2011. So since then, and this year, I've switched to like this really, I don't know, like there's a lot of art stereotypes that are spot on. Very like vibes. We live on vibes, and I don't live on vibes. I'm very much more into structure and into, I guess, a little bit more rigidity, which is wild when you think I'm also an artist. So yeah, that's the culture shock I think I'm speaking of in so many words.
Well, thank you for sharing that. And it seems like you definitely took a different tune, and I feel like different skill sets, getting used to a different place, different environment, how things operate differently, and it is interesting. And like as you said, like you're an artist, but yet you are used to like your rigidity in life and things like that. So tell me, how do you identify, and then tell us a little bit about your personal background.
Yeah, so I'm taking this question as like identify, like I just back to like health educator, like my pronouns are he him. I personal background wise, I grew up on the East Coast, moved around a lot from Maryland to Philly, in between Baltimore, all those places. And generally, maybe professional career wise, I started doing public health again in undergrad, and I focused a lot on health equity and on health equity research, on understanding health disparities, and on community-based and community-centered practices. So I worked in and turned in a lot of different spaces that did that in different ways. And then decided at a certain point in that whole mix to go to get my master's of public health. And that's actually where I started using art and started using painting as really like, as like a form of catharsis and as a way to kind of process all the work I was doing, all the like mental health challenges and everything that I was going through. And like I think for me a pretty stressful time in my life. And that led me into art. And I continued to do that after I was done my MPH, while I was working in different spaces that were public health centric. And then the pandemic started, and I really, in a high overview way, went through like a very introspective, pretty rough process, like I think much of the like world is still going through, and decided that I wanted to like do a shift to focus more on art. So I left my public health job. I was a research project manager, and decided to go get my MFA and kind of, I guess, chase this dream in a very like late 20s kind of way.
All right, awesome, awesome. I like the interview in me wants to dig into a lot of those things that you stated there, but I'm gonna leave it to the latter part of your journey, so we really like understand the progression and your thought process going into that. So, did I ask you what public health? No, I don't think so. What does public health mean to you?
Public health to me, I always think of like the World Health Organization definition, which I'm not gonna recite, but I'm kind of gonna play with, which is really just like I think of public health as holistic well-being, and I think of public health as something that traverses so many and maybe even almost every discipline in a lot of fields or in our world. So to me, public health is just thinking generally about a state of well-being, population level, individual level, throughout all those like social ecological levels. And yeah, just generally like what well-being is and how to achieve that in X amount of ways.
Okay, awesome. I love it. I love it. So you got your Bachelors of Science in Family Science at the University of Maryland, College Park. But I also saw in your LinkedIn profile that you went to Temple University for public health. So is that like community college, or how? Tell me about that. Like,
Yeah, no, okay. So Temple University is like a four-year public school in Philly.
mhm.
I went there for 2 years, and I actually did undergrad or went to undergrad and ran track in undergrad. And Temple cut their men's program my sophomore year. So I decided to transfer schools to continue to run track somewhere. So I ended up transferring to University of Maryland, or UMD. And yeah, so I started public health there. Actually, when I first got to undergrad, my major was environmental studies, but we don't get into that. Um, and then I switched to public health, and then I came to UMD and actually wanted to do public health. With they have their program there is actually community health, and I wanted more so to graduate in 4 years. So I switched to family science. A lot of my credits like from Temple carried over there, and then in that decided to kind of get into other stuff, but switched to family science, which is kind of more, I guess, social work. It's more like a mix between social work and public health, I would say. Social work and just like program planning, a lot of like, um, yeah, program planning, thinking more about family dynamics, thinking more about direct practice work like community health worker, um, centric things.
Okay.
And yeah, in that later on did other things that we'll get into too.
Okay, awesome. So you applied, got into Temple, was running track there. You were environmental science at first. When did you hear about public health?
Right. Actually that's a good question. So I started my freshman year wanting to like I would just want to like change the world, whatever. And I also didn't want to honestly do a hard science like environmental science. I do not have a strong like biomedical science background, biological sciences background, and that was like heavy for that. So I started literally just like looking up like different things I could do that would be like even community centered. I've always had a big interest in blackness and black in the black community in the US, and like thinking of how to literally help my family members going through a lot of issues that I see or see as public health centric issues, systems level issues, and found public health as it was available as a major at Temple, and something that I thought I would be interested in, and it proved to be extremely true. Yeah.
Okay, well, we love people who love public health on this podcast, and I think it's always interesting to hear different people get into public health or just hear about public health because it isn't something that you traditionally just hear or people talk about in general. And so before you moved to University of Maryland College Park, you worked in Temple. Well, during your time in Temple University, you worked as a companion aide at Ellison Nursing Group, as well as a big brother at the Big Brothers and Big Sisters. So tell me about those experiences.
Yeah, those were just like very, I think, undergrady experiences for me. So over the summer, I was looking for something like public health, anything public health related that honestly I could get paid for because I was definitely like a poor college student at Temple and in general. So companion aid is just one of those people that helps like scheduling and taking people sometimes with like different sorts of like abilities or differently able people, disabled people, um, to their appointments, to help them schedule, help them clean, help them just like live out their daily lives to the best of their abilities. And so that was over the summer of my freshman year. I did that, I believe. And then throughout that time at Temple, I think the last year and a half, I was a big brother as a part of the big brother, big brother, big sisters program. So I had a little that was in elementary school there that I hung out with I think like every couple weeks. I tried to do, and their school actually was literally across the street from where I lived. So that's what I did there. And then I also was, I was really, I think, pretty heavily involved in other things besides like athletics at Temple. But those are the two main things, I suppose.
Yeah, and tell me how does that play as like an athlete having to run track as well as doing school as well as these other positions that you do, and how did you balance all of that?
Yeah, I think I was pretty singular in doing. I wasn't. There were other people that did it at Temple. It was a pretty great school. And it was a lot, I think, for me. Like I was always on the move. Um, Always on my bike riding to the city, always running somewhere, not for practice, always doing something. I was on the e-board my sophomore year there. Before that, I was always at some organization's event or something. And I tried to prioritize track. I had to prioritize track. So I did. And I just made room for stuff. I didn't sleep a lot. I still don't, but I really didn't sleep a lot really in undergrad at all. I think like a typical night would be like wake up or go to sleep at 2, wake up at 6 or 7. And then just yeah, every day. So I made time. I knew I wanted to be involved in other things besides track. Um, so I did. I did.
Okay, awesome. And yeah, and I think that makes a lot of sense, especially when we're in like undergrad. We have so much time that we waste doing things that we could probably do more productive things that you seem to be doing. What?
I still
What?
napped and missed things. Don't worry, I definitely missed stuff and got in trouble.
we all we all have. What did you run in track?
So I really mostly jumped. So I mostly did triple jump and long jump, and I was more so forced to run. And when I did run, it was mostly sprints, so like 100, 200, like relays in college. I ran really in high school the most, but I mostly triple jumped in undergrad in college.
Okay, this might be a little ignorant of a question, but is triple jumping considered track or field?
Field, yeah, no, it's field.
Okay, just
So
checking
I
that.
did
That
the field, but it's just easier to say like I
track.
ran. No one knows what triple jump is anyway, so.
But you're trying to start those conversations, though. You gotta put the field in there. But okay, so Temple cut its men's track team, and then you decided you want to continue running. So you went and were able to get your Bachelors of Science in Family Science at the University of Maryland, College Park. You said that you did this a lot. Well, a lot of the reason for choosing this over like public health or any public health or type related degree was because you're able to finish in 4 years. Um, so tell me more about that.
Yeah, I'm still pretty hard-headed. But I was really hard-headed, really stubborn, more so when I was younger. And I just had this like goal in my head. I needed to finish school in 4 years, regardless of whatever I did. So it was just logistically easier for me to do family science, and it was still in the School of Public Health. So my electives were still pretty much public health classes, and I already had 2 years of public health um, classes under my belt from Temple. So I switched to family science for that. And in retrospect, it was definitely a really good idea. I think it made my undergrad experience in general more well-rounded. Just thinking, like I think some public health programs are just very data heavy in terms of like biostats, epi focused. And switching to family science gave me more of a like, I don't know, a certain type of like social, cultural kind of well-roundedness to public health that I think really led me more so to more community-centered, community-based approaches or career paths too that I really appreciate from being there.
Okay. Yeah, that makes a lot of sense. And I think like looking back now, it probably also helped in the sense that just school is not cheap and also time is not cheap. So you save yourself there.
Yeah, that's
Yeah.
true. So I actually I actually ended up staying an extra semester. So I technically graduated in four and a
Some
half years.
okay.
Yeah.
I graduated in 4.5 as well. So we're twins there. So during your time at your University of Maryland College Park, you were a group facilitator at Congreso de Latinos Unidos. So tell me a little bit about that experience.
So actually that was at Temple.
Okay.
Yeah, that was at Temple. And that, so I was a companion aide my freshman year, so summertime, and I was a group facilitator for Congreso de Latinos Unidos my sophomore year. My sophomore year at Temple. And that was another experience really for me. I think that the program there was like a summer program, a summer enrichment program, where we did a lot of different activities with a lot of kids in North Philly, in a predominantly like Latino, Latinx part of North Philly, where I was facilitating just like kids throughout the day, trying to keep myself together. Actually, funny enough, I remember when I saw this, I looked back at my resume and I was like, oh, I did art classes with them there, which is wild because I completely forgot that. I remember like whoever was running the program was like, there, you can draw, right? And I was like, yeah. And they were like, okay, you're gonna do all the art programming like for the kids. You're gonna do art and then like anything athletics, field related. Like so we did that baseball and soccer, and I tried to get them to run and it didn't really work. Um, yeah, so that was the summer of my sophomore year, right before I transferred and moved back to Maryland. Yeah.
Okay, and I think it's awesome that you're just highlighting that as soon as you got to undergrad, you were active, you were getting into different things at different points. And I think, like for me, I was not that way. I was definitely out partying my first year, but
I was partying too.
well, I was partying.
I didn't
I guess I just wasn't doing the other things that you were doing as well. Um, awesome. So then you're also a volunteer assistant event coach at the University of Maryland track and field camps. Tell me about that experience.
Yeah, that was my junior year. That was my after my first year at UMD. I did that, and I was another coach at a summer track club in the DC area that summer too. But after this, and then that same summer, I also was doing the community activism youth engagement internship with Truth Initiative. So I was a volunteer assistant coach, um, which I don't remember how often that was, but it was like during the day, some days, not every day. And then I was doing my internship, not like I wasn't a fellow yet, for Truth, which it wasn't even called Truth Initiative then. It was called something else that I can't even remember.
That's fine. We'll find it and put it in the show notes.
Yeah, it was Legacy for Health, I think. Yeah, I think that's what it was called. So yeah, I did both of those things my first year at UMD. Again, running around a lot. I coached jumps. And that was a week-long camp. It was like really short every day, and it was before my internship started. So I did that, and then I started the internship at what is now called Truth Initiative. And should I get into that?
Yeah, please do. Okay. Tell me more about that.
So then, yeah, I think I did general. So Truth Initiative, I guess if anyone is unaware, is a nonprofit whose general goal, I hope they don't like get mad at me, is like to pretty much, it's a tobacco prevention and control nonprofit aimed at stopping people from using tobacco products and living healthy lifestyles, based in DC. So there I helped with like general, I think like administrative things, filing, scheduling. Also was able to help with like putting input into like programming for youth-centered events and community activist like events. And there I got a lot more hands-on experience with program planning, implementation, and evaluations. So I helped a lot. I'm not gonna lie on that, but I got a lot of exposure to how that works in, I guess, like actual practice outside of like just learning about it in classes for the first time. I think that was like a really meaningful experience for me that I ended up becoming a fellow for later on, and then for a short period of time was a mentor for as well.
Okay, and thank you for that. Were you a fellow after you graduated? Is that how that worked out?
Hello. No, I was a fellow my senior year. So my junior year summer, I was an intern. Then the next year, I was a fellow. Then the next year, I was a mentor, and I actually had to stop mentoring because I was in grad school going through like everything in life. So I stopped being a mentor. Yeah.
Okay, so how does one become a fellow with the Truth Initiative?
So I already had a relationship with like everybody in that department there, and they they had just started that fellowship. Had that? That's not true. They had fellows before, like cohorts of fellows before, and I was still really interested and really liked the organization. I really loved the people I was working with. One of them is still a really good mentor to me, and so I decided to apply to be a fellow because the fellowship was more centered on like you doing an entire activist project or some sort of like programming project from ideation to evaluation or end, like on your own, which I really wanted experience doing. So I was able to do that through them. And they also had like conferences and stuff that I was able to go to and like fellowship with there was again, I don't remember. I feel like there was about 20 maybe 20 of us, maybe something like that, something like 20 of us. Yeah. So that was a really, really great too.
Yeah, and what was that project that you were able to work on?
I then there worked with, I made like a whole acronym for it and it was called TEEF. And I can't remember what it stood for, but the goal of the program was to go into a local high school. I was living in Baltimore at the time, and I was partnering with a high school in Baltimore to like, I wanted to create youth educators to go into classrooms. So people in the high schools, students in the high schools, my bad, would go into the high schools. I would pretty much teach them like baseline tobacco prevention and control, like educational, I guess, points. And then they would go in and spread that throughout the school through their different like homerooms. And that was generally the gist of the program. And I honestly, I don't think I even was able to, this is me being like more honest about what was happening. I honestly I didn't finish, I don't think I finished that. Like I got to the point of recruitment in the schools and was talking to administrators and everything. And then I believe the fellowship ended and there was like, I think logistical stuff going on. I don't know, that I wasn't able to actually even like implement the program fully. And that was just like one of my first, like, I think failures, or learning experiences, I would say, from that fellowship. So it was a really cool idea. And funny enough, one of my cousins was going to the high school and I tried to recruit them. I remember that. And they didn't want to do it. But yeah, it was a really good learning experience again for where I'm at right now.
Yeah, absolutely. And I think I laughed earlier is because it's like acronyms don't really matter at the end of the day. I'm just glad that you can explain like the type of work that you're able to do as because I think that is more important at the end of the day than what it was called. And that seemed like really cool work. It's really cool that you were able to like develop this entire project and really like implement it or start to implement it. And there are probably a lot of learnings in there. And it's not like a lot of, I know undergrad students don't get the opportunity to do a project or at least work on something that spans so much scope. So that definitely seems like it was beneficial, even though you didn't get to complete it. If you want to consider that a failure, I would not, because you got a lot more experience from that experience than most other undergrad students in doing like actual public health work as well. Okay, so after this, anyway, so I'm guessing you graduated after this. Were there any other takeaways from like undergrad that you wanted to share with us?
General undergrad takeaways: be involved in stuff, as I may have overstretched myself and continue to through grad school as we may get into. But take advantage of everything that you can right now. I'm working with some undergrads in my program now, and I just keep telling them like, yo, ask questions, advocate for yourself, and just do stuff. Do whatever you can. I was in a lot of stuff, again, maybe too much, but that was my biggest takeaway. And then also like, yeah, no, also just do whatever you can, make time. Like there is enough time in the day for a lot of things, but also like I should have prioritized sleep and rest a little bit more too, which I think is important, especially now. Like there's so many other external factors going on in the world, as there were then, but I think it's just very palpable now. So take that time for yourself, but also never forget to advocate and be proactive about like your undergrad experience.
Yeah, I like that. That's really great insights. And I think like to that point of like take on more experiences, ask those questions. A lot of the times we don't even know what we want to do or what is out there or how to do things, and just being curious and wanting to learn and take on new experiences just to see and get a feel for different things is, I think, is very, very beneficial, especially in those early years of your career. Um, so yeah, so thank you for sharing that.
Yeah.
And then did you graduate and go straight into your MPH, or were you a health educator before?
So yeah, I graduated fall 2015. Um, and I was a health educator from like that January or February, straight until I went to my public health program. So I was applying to jobs and applying to public health master's programs. Sorry. And I, yeah, was doing that, definitely just trying to use all my cards. So I was a health educator for Baltimore County Health Department for the period in between, a little bit almost like, called like a faux gap year. That period in between me doing undergrad, finishing undergrad and starting grad school. And there I did a lot of sexual health related programming and education. So going and doing STI, STD testing at different venues, doing sexual health education all over Baltimore County. And again, getting more like, just getting more hands-on experience, like with working in a health department, learning how like a government agency works. So I was working for the first time in a government space as opposed to like a nonprofit space, which I was prior to that, which was super different for me. Like I realized like I didn't like the bureaucracy, but I also liked the stability of it, but not the not the rigidity of the programming sometimes. I hope I don't like get in trouble for any of this stuff. Great experience. Yeah, so I did that for 8 months, and there, I think the biggest skill that I really got to practice the most there was, first I was fresh out of undergrad, so I was like the youngest person there by like a decade at that time, and I got a lot of experience facilitating, and I think facilitating different groups of people. Like most of my experience before was with kids, with youth. Um, and there we were working with like substance misuse programs. We were working inside of carceral facilities. We were working in a lot of different spaces that exposed me to a lot of different, just understanding communication and public health communication, which makes a lot of sense with, again, where I'm at now in my life.
Yeah, yeah, thank you for sharing that. And I think it's important that you highlighted that you were able to get experiences in both like nonprofit side and then the government side, and realizing the pros and cons that come with both and seeing how like your personality fits into that. Because I think that in itself is an experience, because you might work or like intern with nonprofits your entire undergrad and master's career and then end up working in government. And that's a whole different type of ball game than in a nonprofit, which tends to be more chill, a lot less bureaucratic. Not all the time, though. Not all the time.
So chaotic sometimes.
For sure, for sure. So when you graduated from your undergrad, were you thinking that you were going to get your master's of public health?
Yeah, so I was applying to master's programs and applying to jobs at the same time, knowing that I would start school in the fall. Um, but not knowing that. I wouldn't say that. I wasn't 100% set. I really wasn't sure I'd get into a lot of master's programs. So that was another reason I was like, I'm gonna go start this job and, ride this and figure out what I'm gonna do if I get, like, cross the bridge of going to graduate school and like in this job pretty early. When I cross that bridge when I get there. So yeah, I think time went on. I applied to places. I got into a good amount of schools. So really surprisingly for me, I had a lot of self-doubt too, like, again, transparency. And so yeah, I had planned on attempting to get my master's in public health specifically at that time.
Okay, I'm gonna ask you about that self-doubt part and how you overcame that, but I also wanted to ask how did you, because you said when you became the health educator, you were the youngest person in the office by like 10 years. How did you navigate that, and what was the learnings of navigating that space?
That was interesting. I was definitely the little brother of my whole like team department. I think it was, I forgot like the term that they used. Um, but I just kind of took it as like I can insert fresh energy into this and be like that young energetic person and be that person that like something I've leaned into again as I get older is like asking for forgiveness as opposed to asking for permission for things. And like at that point, I definitely used my youth as a way to like be able to do that. And still being, I think, kind of get into that point of like self doubt in myself and like trying to build some self efficacy in myself at this point. Me practicing facilitating in those spaces, building up that skill was definitely something that helped at that time with building like that or maybe yeah, building confidence in myself and my abilities and all the stuff that I did before that. Yeah, all the stuff I had done before that.
Okay, that's awesome. And then, yeah, I don't know if you read. I think it's the 4 work week where Tim Ferriss says something along those same lines of like, don't ask for permission, ask for forgiveness. And I think it's very very relevant in a lot of circumstances. And I feel like a lot of the times we're in the headspace of oh, let's not push back against this. But a lot of the times when you do push back, it's like it doesn't take much to fix what you did if it
Yeah.
needs to be fixed in the end. So yeah, I like that thought process, and I think we should continue to innovate and push the limits of whatever the boundaries are to really see where we can take things. Because as we can see today, things aren't where they should be, and people need to push back on systems, practices, policies, and everything in between to really get to where we need to be. Um, so
Yeah.
now bringing you back to self-doubt here. So you said that you had self-doubt about applying to MPH programs, about all the things that you did. Like, just being transparent here, you did a hell of a lot more than I did in undergrad. So shout out to you. And
But my grades, because of all those things,
mm,
were not strong at all.
I don't know, but experiences over grades, and in the long run, grades
Yeah.
are good to get you into that first position and things like that. But experiences over grades, every day, in my opinion. But yeah, you done a lot of great things in your undergrad, and I think it's important to also highlight that you've done all these things. You're doing track, you're doing all these extracurricular activities, these internships, this fellowship, and yet you still have like these thoughts in your head of self-doubt. And I think it happens at all stages of our careers and our lives, and just getting into new places and just getting into unfamiliar spaces. And it is something that we all, myself included, battle with at times. So tell me, how did you overcome that self-doubt feeling, if you like overcame it, or if you just like trudging through, however that experience was for you?
I think it's an ongoing process for me personally. I at that point, I mean, throughout, I think really this is an ongoing thing for me. Am always looking for comfort in uncomfortable situations. So I think example of that are just me saying, whatever, I'm gonna apply to master's programs, whatever, I'm gonna apply to jobs, whatever, I'm gonna just do it. I'm just gonna try these things. And again, I think the worst thing that can happen is someone say no to me. And a no is not even like that's not even people tell me no all the time. And it's just like it is what it is. Or honestly, people don't get back to you. That's what happens. You take 3 hours to do an application for something, or 3 weeks or 3 months. And excuse me, you have that practice in doing it. And that's what I think I've begun to really learn now, is that whatever I do, whether it is something that whether it's something that ends up being a quote like failure or not, it was practice for whatever comes next in my life, whatever opportunity like presents itself or I find after. I have experience now doing it, or have experience now in some way with that. I think my self-doubt, I'm gonna like try to answer this a little bit more. Um, Self-doubt, things of like self-efficacy, questioning abilities and things like that for me is definitely something that's still prevalent me, prevalent, terrible.
Relevant.
uh, Something that's still very much present in my life as I'm literally now like in a whole different like discipline, in a whole different world. And what I've learned and kind of applied in this space is that I have a lot of experiences and have a lot of knowledge in general about whether it's specifically tied to, you know, principles of art or conceptualization or abstraction or something like that, which are things that are always hovering around me or just like in my art program now. Um, no, but I do have a lot of experience talking through ideas, a lot of experience fleshing out details, and a lot of experience um, facilitating rooms and spaces, which is something that will continue to be prevalent. I have a lot of hard skills that I have from public health that I carry over and can use that no one else has. And I think what I've realized is the uniqueness in your own abilities is so, you realizing that specifically is so important to you getting over like self-doubt, like understanding that. And then also just leaning into vulnerability is something that has been huge for me, like understanding that you can be vulnerable as long as you can be, just period. You can be vulnerable, and there's a strength in that, not a weakness. You
No,
know?
yeah, absolutely, absolutely. Some of like my best Instagram posts have been when I've like been talking about all the failures that I've had, and it's good because people see a lot of people up here, quote unquote, successful, and they don't see like all the things and all the same thoughts that everyone has, you know. We all have to go to the same toilet and use the same toilet, you know. We're all in that same place. But I think like the important thing that you said, especially around your masters of public health and the self-doubt you had there, was that you're still like, okay, I'm going to take the steps to do it regardless. I'm going to like apply, you know, like it is what it is. A no is just, I'm back to where I am in the first place. So like let's push through and do that. And thanks for sharing like your reflections on how you're taking self-doubt now into your public health knowledge space, into this art space, which is probably a whole uncomfortability, different, like I can't even imagine, to be honest. But we'll dig a little bit more into that in a little bit. So you got your master's of public health at Brown School at Washington University in St. Louis. St. Louis.
St. Louis. So yeah, it's the Brown School of It's actually a school of social work. The Brown School of Social Work at Washington University in St. Louis.
All right, everyone forgive me. I'm from Trinidad. I don't know some American towns and
You're,
cities.
you're it's fine. It's a French word. Well, French origin, I believe. So Saint Louis would be yeah.
Okay, awesome. Did you have a concentration?
Yeah. So my concentration for my public health, my MPH was actually urban design. And that kind of I always am trying to like reconnect old dots. And that was, I think, me circling back to environmental health and environmental, like that environmental beginning I had literally from my first year of undergrad. I had a really have to this day impacts on health outcomes, on environment, or in a strong interest as well in environmental health. Um, so I was able to, I actually was really focused on finding a program. Wow, this is not that long ago, but so much has happened. I kind of forget why I did some things, and now talking about it, I remember. So when I was applying to public health programs and PH programs, I really wanted a school that had a like urban design, public health like connection of some sort, whether that be like urban planning, urban design. Some schools to like urban health as a way to emphasize like built environments and like just cityscapes. Um, and cityscapes in the relationship to public health. So that was my concentration, urban design. It was interesting because I took a lot of classes outside of the public health social work classes at WashU. I had a lot of, or not a lot, but a good amount of exposure, including our practicum over my summer there with the architecture school at WashU, which was like a little dip in my toe to like another culture shock, like more akin to like the art world, which was, yeah, just different.
Okay, awesome. Yeah, and that's definitely not a concentration. I'm like 100% sure I haven't had someone on the show that has an MPH in urban design before. That's for sure.
I can so really I think specifically what we learned about at that point were thinking more about design principles and how they can impact someone's definition of a space and a place, and how that can be applied to health programming, or like, I guess, health interventions. So I think like a really easy tangible example of that was like we had a lot of practice doing like health impact assessments for things like biking lanes and like transit oriented city design projects. We looked a lot at environmental health data in relation to residential development, or it was not residential development, but real estate real estate development, and also looking at like zoning laws and thinking about those impacts, those structural impacts and systematic impacts that they have on health behavior and health outcomes, and on public health programming.
Yeah, that's very, very awesome. Like I always think when we think about like good urban design, I think about when I went to Holland in Netherlands, just how it's so walkable, so bikeable. Like you really don't need a car. There's public transport everywhere. There are a lot of spaces that are just for people with no cars around. And I think that is a model has shown that it's been like just improves health, improves like community. Um, but in that same vein, like building out infrastructure is billions and trillions of dollars, and it's really hard to change the infrastructure that's already built nowadays. Hopefully, well, Biden just passed that $1 trillion infrastructure bill. Hopefully there's a lot of public health people in there working on more inclusive and better built environment stuff in that.
Yeah, I don't know, but my dream job was like to be a public health consultant in like an architecture firm, or like a public health consultant in like an urban planning department or something like that. So I think of that, and I think they definitely exist, but I feel like since the pandemic, there's been such a, I feel like, I'm not sure because I haven't been like really job hunting in public health, but I think there's been a big expansion of public health opportunities in like less traditional spaces like that.
Absolutely. And I think it's just important that we do have public health people in less traditional spaces, because we have like a huge skill set and just an eye for population health. And when we think about population health in probably all aspects of life, it just improves the health for more people than it does not. So yeah, I'm all for public health people in all spaces and everywhere. But anyway, getting back to your MPH now. During your time there, you were a research assistant at the Brown School at Washington University at St. Louis. So tell me about that.
Yeah, so I was a research assistant in a couple of different capacities. I'm just going to talk about like I was one, and they differentiate between like a master's research fellow and a research assistant. So I was a master's research fellow for what was at the time called For This, a lot of like name changes in places I was. What was at the time called For the Sake of All, and then became Health Equity Works, I believe. I need to just like open my CV. This is so bad that I don't remember. Yeah, I was a master's research fellow for what is now called Health Equity Works, and then before that, or in between that, yeah, or during that, I was also a research assistant for a professor at WashU who was doing a lot of work with social, what was he doing? With health disparities, qualitative research dealing with health disparities, and also was a research assistant, technically by name, when I was doing my practicum over the summer for WashU. And that was when I was working with a collaboration between the Prevention Research Center at WashU and the school, some professors at the professors and architecture firm, um, working with the School of Architecture and Design, I believe it's called, at WashU. So I did a lot of different things at WashU, most of which, how do I like phrase this in like the most succinct way? When I was a master's research fellow, I did a lot of community-centered assisting, a lot of facilitation, and a lot of like literature reviews, a lot of um, editing, and a lot of like support in helping writing scholarly like white papers, pretty much. I did a lot of like interview conducting. I drafted like helped draft memos and papers and created like a lot of reporting graphics, descriptive stuff, infographics and stuff like that. I was doing a lot of or getting a lot of practice with like heat mapping and using like at that time ArcGIS with health equity works because I used that a lot. That was really cool. And the other place I was working with, or other professor I was working with at the time, did a lot of qualitative research. So I got more experience doing one-to-one interviews and group interviews, focus groups, and got a lot more experience from both of those places doing qualitative coding, thematic analysis. Got experience using like those programs like NVivo. I mean, I started using NVivo there. And then for both of those places, or both of those positions, doing like a lot of secondary data analysis, or like a lot of data cleaning, which I loathe. Data cleaning, descriptive analysis, and like some like inferential type analysis there. And then my practicum, I just did a lot of the same stuff with a little bit more coordination and involved because it was a small team and it was kind of my project. Um, yeah, so I did a little bit more coordination and scheduling, like a little bit more like, I don't know, managerial types, not managerial, coordination. I was like, no. Yeah, and then I got just more practice using like quant softwares there.
Okay, that sounds like you did a lot of different work there, especially heavy on the qualitative work and like the facilitation and like one-on-one interviews and NVivo and all those cool programs that people do to analyze and thematicize
Yeah.
qualitative data, which is interesting all in itself. And that I feel like there's a lot of opportunities for people to do a lot of work around that, especially in your Masters of Public Health program. I know when I was doing my MPH, a lot of students were doing NVivo projects using like Twitter for like sexual education type things and like some really, really interesting ways of getting and understanding data and what people are saying around different topics. So yeah, look into that if you're interested as well. I wanted to ask you more about your time with the architecture firm. Is there like any takeaways that you got working with them that you think generally public health people could like learn from or gain from?
Yeah, I think one of the things that I learned was that you really do need to be able to translate. There really are like, silo. I think we talked a lot about this when I was in my master's program, like silos of knowledge and silos of practice. And you really have to like actively seek out those spaces to learn to get practice translating public health lingo to other spaces. And that was an opportunity for me to be able to translate this stuff. And I realized there, and just generally in my grad school experience, that being able to talk about what you do in different spaces is like such a, I don't know, maybe I don't think it's underrated, but such an important skill to have. And working with the School of Architecture at WashU, and then working with the architecture firm that we were working with, was really like and that was like also my first experience working, I guess, with like a for-profit institution like ever. Other than maybe like thinking about a university as for-profit institution. That was like my first time working with a regular old, I don't know, business, like
Mhm.
I guess traditional sense. And I was like, where is what is it? Where is like the benefit for this? Like everything is like, what is the deliverable? And I think a lot of times when I was in other like nonprofit spaces, we were always chasing funding and stuff, or they were always chasing funding. I was always helping people chase funding and like supporting the chasing of the funding. But it just feels really different in a for-profit space. So the translation of like your skill set to a for-profit space, especially coming from like a public health educational background, that practice is like I think it's super important, and like, yeah, I think it's super important.
Yeah, and I like that a lot. And I think one of my friends who came on the show, I can't even remember which episode it was. She was saying that like public health is very marketable to so many different industries because the
Mhm.
skill sets really are able to transfer. It's just really how do you talk about it? You really have to be able to show and talk about, okay, this what I did here is relevant to what you're doing here because, and I have this skill set that can help you translate this work because, and I think that also speaks to probably how you're thinking about yourself in this Masters of Fine Arts program, which you're going to touch on a little bit later. But yeah, I think all of those are very important, and thanks for sharing that. Yeah.
On that point, like, just really generally, like, biostats is statistics, is econometrics, which is used in every business, like marketing, research, market analysis, all that stuff is like biostats, epi stuff. Yeah, not necessarily epi stuff, but epi is relevant another way in other ways, but like specifically biostats and program planning implementation. If you're like a health policy admin person in like a master's program or in a public health space, all those skills are super transferable to any other space. Even like in my program now, like the writing skills I developed, um, doing like helping with people writing grants and helping with reporting at other jobs I've had and then in jobs we've already discussed, are transferable across any space, and like just super useful skills regardless. You just have to know how to talk about them, because I would talk to my friends who work in advertising or accounting or like just very different spaces, and they wouldn't think that I would know what they're talking about, but it was because they just had a different language what they were saying. And then I'd see like the spreadsheet and be like, oh, you're just doing like, I don't know, I can't think of literally any term right now, but like you're doing the same thing that I do.
Mhm.
You're just calling it something else, and you're doing it like to figure out how to market X product to somebody else, or how to, I don't know, or how many people are reading your article, and how to like who to reach out to get more a bigger audience or something like that. So yeah.
Yeah, I absolutely agree. It's just different ways of thinking about it, and but at the end of the day, we're all trying to do very similar things and similar skill sets to really benefit that kind of work. And
Yeah.
I didn't forget also, you said that you started your youth activism fellowship, and then you also were doing your MPH program, and you kind of said that you stopped that because it was too much. I want you to share a little bit more about that experience.
Yeah. I was really into like working with Truth Initiative and being in a space where I can mentor fellows, but I did not have the time, or I just did not have the capacity to do that. And I knew that, and my mentors at Truth Initiative knew that too. So yeah, I had to stop. I was a master's research fellow. I was a full-time student. I was a mentor for Truth Initiative, and I was also a research assistant on and off for the qualitative work I was doing with the professor. And it was just too much. And this is also actually where I started painting as like a mental health kind of like coping mechanism. Um, so, and I wasn't painting like, I'm not saying that as like a way to like, it was another chunk of time that was being taken up, But just to like illustrate, like I think for me, the mental health challenges I was going into, because at this time I was also like, also what else was going on during this time? Just a lot of like mental health challenges, a lot of like stress being at a predominantly white school. I think I was the only black. I was like one of like two black people. No, that's true. Only one of like two black men, or very few black men in our cohort. Only black queer person, black queer male in our cohort. Like if I walked through the building, everyone knew how I was, and that was like a pressure that I wasn't used to in so many different ways. I've always had like not like a regular haircut. I always dressed kind of like, I don't know, noticeably. And it was just a lot of pressure. So we decided that it was best for me not to do it anymore. And like I said, the person who runs that is still one of a really good like mentor to me to this day.
Okay. Yeah, thanks for sharing that vulnerability, and I think that's important to just highlight that, sometimes we think that we can do a lot more than we can, and it's okay to understand that we need to stop some things at some point in time to really make time for ourselves, because if we can't take care of ourselves, we can't do a lot of the great work that we want to do to take care of other people.
Yeah.
And yeah, I could definitely feel you in a lot of ways, and being like very few black men in a lot of spaces, but in especially in like the institutional educational field, and how hard that could be, and especially society makes it hard for us as people, harder for you as a queer person to just show up and be yourself, and I think that in itself is harmful,
Yeah.
and like we need to try to shift and make societal norms where people can just be themselves and show up as themselves and be happy, because I think all of those other things play into those mental challenges, and like those, that self-doubt and all those different things, but
Yeah.
greatly appreciate the transparency and the authenticity there, and hopefully everything that you shared there helps someone else, and because I think that's the biggest thing, because you never know what you say or what you're doing now might impact and help someone else. And I also want to touch on the part of like you go into art as a form of like therapy for your mental health.
Yeah.
I have this other friend who's on the podcast, Kristen, who used to be a drug user, and she went to running and exercising and triathlons as her form of therapy, and I think like everyone has their different form to cope with the stresses and things in life, and I think we all have to find those spaces and those ways to really express ourselves, and so we can be whole and show up as best as we can in this work. And I am talking a lot for my podcast. This is your episode, not mine.
No, this is a conversation. I like this. This is good.
Okay. Well, I appreciate you sharing that, because that means a lot, and I bet it means a lot to someone else that's listening to this right now.
Mhm.
Okay. So just go back to like the self-doubt part. How was that like going through your program? Were you thinking about like self-doubt and getting jobs afterwards as well? Or how was that for you?
I'm like thinking of next steps for my MPH. In addition to all the other kind of stressors that were happening to me while at grad school, I also was in the Midwest for the first time. I was in St. Louis for the first time. I didn't know anyone at all when I moved there, except for my roommate who I had met super briefly. So on that, I didn't like St. Louis. No offense to any. I mean, I don't know. Anyone who knows me knows this. I didn't like St. Louis. And so I wanted to leave, and that's kind of difficult, I think. It's kind of difficult when you are in a program anywhere, like even now, me being in Chicago, you build a social network kind of around your master's, and that is how a lot of people get jobs. So I had, I think, an easier time job hunting in St. Louis, but I had no desire to stay in St. Louis. I think that was in for professional reasons, meaning like I just wanted to be in a bigger city, and also most of my family, close family, is on the East Coast in the Northeast. So in terms of job hunting post MPH during the end of my MPH. My last semester, I was applying to jobs every day, pretty much. A job, a fellowship, something like that. I did not at that time want to pursue any more higher education things. I knew I was done for a little while, but I also knew probably want to go back at that time for my PhD. And so but I didn't want to then, and I wanted to go back east. So I just applied to everything. And in that note, I didn't get like anything. I didn't have a job when I graduated from my MPH. That was in like June. And then I moved back to stay with my parent or my dad in over the summer, and was looking. It was actually, this was a really, mental health is just a common thread throughout my life for everyone. That should be like a sub line for this podcast. But that period, that was right after my graduation from grad school. For the next 6 months, I was unemployed, living with who was I living with? I was living with my friends. Yeah, I moved back to stay with my friends who had an extra bedroom in Philly, and was looking for jobs. It was really, really, really tough. A really tough hit on my confidence, and a really tough hit then, therefore, on my mental health. And again, I had started painting the year before that. And again, my friends were so great for like letting me like paint in their space and like use up their like part of the living room for like my studio, which is like all this stuff is just wild in retrospect. But so I didn't work for like 6 months, like, again, to be honest. And I got I got interviews. I didn't get a lot of jobs. And like my confidence just dwindled with every like pass email that I got. And I ended up getting this part-time job at a nonprofit in Philly, where I was a I was a capacity building associate, which was really like an administrative role, more so an administrative role for a nonprofit in Philly that dealt with like ending homelessness in the city. And I did that part time. I'm getting in like just talking.
Oh, no, no,
So
no. Absolutely. So this is the next question I was going to ask. So you can get into this, and I didn't even know it was part-time. So that helps us in the
yeah.
clarification. So yeah,
Mhm.
continue.
So I didn't have. It was just that was just such a like rough time. My friends, shout out to my friends and my family in Philly and like everywhere for like really holding me down during that period, because that was like later on, this is also a thing, like I got diagnosed with like as being like manic depressive. So this was definitely like a precursor to that. Like I definitely like a really like depressive episode for me. Anywho, so yeah, I was doing being a capacity building associate for this organization. And there, in that sense, I helped a lot again with like scheduling, planning, creating a lot of protocols, doing a lot of like administrative capacity build, supporting, do a lot of administrative capacity building for the organization. And also like doing for that, in that respect, helping or trying to help like push the research and data and evaluation department of this like nonprofit to grow, because I at that and to this day think that like that is like such a huge component of nonprofits that's like struggling. There's not a lot of like research in some nonprofits unless they're like specifically focused on that, especially things like, I don't know, those nonprofits like this, they were really focused on like just providing housing and continuum of care, and really just direct service stuff, and not as much focus on building up the research, and building up like evidence in their own practice, right? Not right, but like, yeah. So I did that part time for about a year, right? I had a lot of jobs in my short life. So yeah, I did that for about a year, and it was a part-time job, and I was still struggling a lot to like even help my friends with their bills. I was still living with them. And like, yeah, I'm gonna stop there. And like, I don't know. Yeah, I'm gonna stop there.
No, I think everything you're saying there fits pretty well into like your story and your timeline, as well as like expressing the things that you have to go through like in your life. So I guess to end or to talk about what was the research project coordinated to at Washington University of St. Louis. So did you move back to St. Louis to get this position?
Sure did. I
Yeah.
sure, yeah. Again, I was looking. I needed a full time job. I needed a full time job, and so I have really great network around me, like just like great people. And one of those people told me that they were starting, or a new professor at WashU in the research center I used to work in was starting a new grant funded project where they were looking for a research coordinator. And I'd actually done my practicum with them. So they referred me to be the research coordinator. I interviewed with the PI and PI, principal investigator, and ended up getting the job. So that started in August 2019. I moved back to St. Louis, and I knew, like, I did, like, my what did I do? I came to terms with like knowing that I have to go back to this place that was like super triggering for me, low key, and that was fine. Like, I knew I was older. I had been through all this stuff in Philly and was like ready to go do a great job. I've always wanted to do research. Like, this is a perfect job for me. I wanted to like get get more research experience and like and I guess like a more lead position. I was a lead, like I was like the lead person for this project. They had started a few months prior, and the project was doing in a lot of things. It was like a multi-pronged study where we were pretty much trying to, let me just step back because I just had this job, but we were studying one of the largest, or the largest urban park in St. Louis, trying to figure out, first of all, the overall use and patterns temporally and spatially of this park. So who comes to the park, what do they do in the park, how many people come to the park, the usage day to day, seasonally, who draws crowds, what doesn't draw crowds, to report back to the grant funders, which were the manager organization or the funders of the park itself. And then in addition to that, figure out different ways to diversify the populations that use the park, and then also just figure out and investigate like other ways that green spaces, urban park spaces can be used to improve health outcomes for populations. So getting back really to like my MPH program, like my master's in public health and urban design, this was like a perfect fit for me. So yeah, I did that for about 2 years. It was a grant funded position for 2 years. And then, yeah. So I can talk more about that if you want to, or we can like, pivot or something. I don't know.
Yeah, we can talk more about that just because, well, firstly, shout out to your friends for holding you down and all that great stuff. Sorry, I got to go back to St. Louis, and even though it's triggering, but a job is a job, and I guess you realize that too. But I think that like everything you said there is really awesome, and I think it's cool to just hear because you don't hear people talking about, oh yeah, that park, there's this amount of usage. This is what people do there. This is how do we get more diverse people in there? Like, what kind of events draw people to the parks and things like that. But these are all things that people are looking at and researching and thinking about and seeing how they can create better green spaces and better use cases for all these different spaces that we have around. So yeah, I would love you to share any more about that you would like to, because it's not something typical that you hear about, but it's a very cool part of public health, in my opinion.
Yeah. I think my, I would say, well, so what was my favorite part about that job? Was the qualitative aspects of the project. I was really excited to do what was actually, this is also goes into like pandemic time. So we had to pivot a lot of, I guess, like deliverables for the project for the funders because of us not being able to be in person. So we were going into the park as a team of at the height, maybe like 8 or 10 people into the park, and literally like counting people and noting like the activities they were doing on a daily basis. And we stopped that about halfway through the data collection cycle that we proposed to the funders, and we, because of the end, couldn't do anything in person, or yeah, couldn't do anything in person at all. And the project is still going on, and I don't think they're doing anything in person. I'm not sure, so let me not speak on that. I haven't caught up with them for a while. So one of the things that we did after we pivoted to stopping in-person like data collections for the observation-based portions of the project were that we started to like try to ramp up the qualitative aspects that we could do over Zoom. So we did focus groups over Zoom instead of in person. We did one-to-one interviews on Zoom instead of in person. And those were amazing because we had different groups of people, community members, we had community stakeholders, we had government officials, we had, I want to say about 30, no, that's not true. Like, yeah, about 30 people doing focus groups or one-to-one interviews. And we also had citizen scientists, which were people that were trained in a different, like a adapted version of data collection that we were doing in counting people. And for that, I think for anyone who knows this, we were using like the SOL Park method, System for Observing Parks and Recreational Spaces. The acronym is wrong, but you get the gist. And we're going back to the acronym thing. So we did citizen science, use citizen scientists or partner with citizen scientists for them to go into the park and take photos of different infrastructural aspects of the park and different aspects of the park in general, meaning like they're a field and there's people playing in it. Someone might take a picture and say like, I love the use of this field, and people actively utilizing it. Or some people, and then they would also code it like good, bad, neutral, or people would take pictures of like infrastructural things like cracked sidewalks or knocked over stop signs or things like that, and say like, hey, this stop sign is knocked over at this intersection, like sad face. So then we would then go back and parse through all of the data collected there, and before I left, just like really do like mostly thematic analysis of like what was going on. So general overview, like 50% good, 50% bad, or not. Those are not true statistics. Just like false. And thematically, like laying out patterns that people pointed out in relation to the data that we collected quantitatively. So we also did like surveying when we were in person, and that switched to online, where we asked 8 different like supplementary sets of questions dealing with mental health, dealing with diversity, equity, and inclusion, dealing with transportation, regarding the park, things like that. So it's a really expansive, multi-pronged project. Really cool, really great experience, like great experience. And yeah, during that time, I also decided that I was gonna go to art school during this
Yeah.
pandemic.
Yeah. Awesome, man. I'm gonna ask you about art school in a little bit, but that is awesome. And I think that work sounds a lot like Photo Voice. I don't know if you've ever heard of Photo Voice, but it sounds like taking pictures, captions, themes. That's very Photo Voice like, but
Yes, wait, I just heard what you said. It's literally yes.
yeah.
Yes. That is what, so wow. That is what we use. Sorry.
Yeah.
I'm sorry, I just blew on
No,
it.
no, you're absolutely fine. But that is awesome just to hear, because it is something that happens that we don't think about. So I'm glad that you highlighted it here, just so that we know that. And earlier, just like a little bit earlier, you said that you all were trying to, or like one of the goals was to drive new demographics or new people to the park. Like what kind of things do you do to drive, or do you just give like recommendations around that?
Yeah. So what we were doing for deliverables reporting to the funder was providing recommendations, and then also like possible implementation routes for the recommendations to, if anyone's like not aware, like St. Louis is like a pretty like spatially racially segregated city. The north side of North County is like 80-90% African American. The south side is like a little bit more like ethnically, I guess, diverse, racially, categorically diverse, but still mostly white. And then western parts of St. Louis City, I mean, not really St. Louis City, the city is mostly north south, but west parts of the county are like majority white, super affluent, high income. And then on the east side of the city is Illinois, and that is kind of mixed as well, depending on, not mixed, but like different, mostly white, mostly black neighborhoods throughout. So the park though is right in the middle of St. Louis, but the usage of the park doesn't reflect the racial ethnic demographics or even social economic social cultural demographics of the city. Most of the users of the park are like white, like stereotypically like white middle class people. So we were trying to provide data to like back up those things, and also recommendations as to how to diversify that. So like, I don't know, some of the, most of the other, we just had something, they just had something get published. So I'm like, can I share the results of this? And I'm like, I don't know. So I'm not gonna like say specifically, but we got a lot of recommendations from those community members. They drove the qualitative aspects of that, really drove the recommendations for how to get different types of people into the park and make them feel comfortable to come to the park, because that was a big, I would say that like that was a thing that a common thing that came up throughout the qualitative data collection.
Yeah, yeah, awesome, awesome. Well, thank you for sharing that. And if it is possible, and if it is okay for you to like, if you find that report and it's like available online, open source, just send that to me and I'll put it in the show notes, and people can check that out afterwards as well.
It literally just got published, so I have to. They have to. Someone has to send me a PDF or something.
Yeah, no stress, no stress. Don't even stress about it. Okay, so during this time, you decided that you wanted to pursue your Master's of Fine Arts at the University of Illinois, Chicago. You also said a little bit earlier that you wanted to pursue your PhD. So why switch from PhD to Master's of Fine Arts?
Yeah. So throughout 2020, going through all these worldwide, national level like events, I was trying to do like, soul searching, like where do I fit in this? And I was deciding again, knowing that the job I had was a contractual, like finite job. It was a 2-year contract, like project coordinator, research project manager position. Knowing that I have to do something, I have to find something afterwards. One of the routes I went through again was thinking about what if I wanted to go. This was the perfect opportunity for me to go back to school and get like, this final like terminal degree for me, I guess. So I was trying to decide like, do I want to do public health, or really, first of all, do I want to do a PhD? And then I was trying to decide if I wanted to do public health PhD or social work PhD. Or at this point, I started to get much more into like reading about Black studies, thinking about Blackness and race and ethnicity in the US, reading more and hearing more, again, because of what was going on in the world, the health disparities, dealing with COVID-19 and the pandemic, the continued public killings of black people in the US, and like the systematic nature of that. I started really like just learning, not learning more, but just like not being able to ignore the realities of what is truly happening in our world, in the country specifically, systematically, and wondering if I was going to go back to school, what would be the best way for me to, like, again, thinking I can save like the world, like where is my place in this? So I was weighing my options, looking at different PhD programs, and then I kind of went through another really deep depressive episode, like sometime during the pandemic, near the end of my job, and lost track of that. And then I kind of, I don't want to say like got better, because I know that's not like the right terminology to say, or term to use, but kind of moved out of that and, gained some better coping mechanisms. And 2021 came, and it was like, okay, time to start applying to jobs again, or time to apply to PhDs. And then I started journaling. That was one of the things I started doing during the pandemic. And I went through my notes and I was like, you said you wanted to pursue your art. You said you wanted to use this as public health communications. And I think this is the point where I can like kind of talk about my art a little bit more and what it is and how it started. So I started using my art again as like a form of catharsis, as a coping mechanism to the stress going on around me, and also as a way to like synthesize and like illustrate public health concepts, just to like play with like health communications, because that is something like I've had a huge interest in my entire life. Like I have a friend who works in advertising. I've always like envied like the marketing creative direction aspects of like advertising, and like I was thinking of my using my art as a way to just play with that and explore that, just really explore that. So I remembered like was I making art? I wasn't making art. That was another thing that happened during the pandemic. I was so going through so much stuff that I stopped painting at all, which a lot like I think led to a lot of issues personally with me. And I remembered like, oh, you do this thing, you love it. All my art was like in storage, so like there was no visual cues or anything for me to remind me of that stuff. And yeah, so I decided then, then came to the point where do I want to do a PhD in public health or apply to those, or do I want to go a whole different way, like literally just career shift, career whatever, change your path and go chase this other thing. And this is coming back to the self-doubt and all that. Like I was like, you have to face this fear. This is gonna linger in you forever. And when I went to undergrad, I wanted to major in art and I didn't do it. I went for what was at the time something I considered more safe, which was environmental studies, and then as safe still public health for like a job. So I was like, there's just no reason for you to try to chase safety. You're just gonna continue to be in this weird space. And not to say that a public health PhD was like a safe space at all, because like academic job markets are like crazy too, or not crazy, but just like super rough as well. But it's a space where I'm comfortable. Like I had a lot of research experience. I had a lot of really great professors that were willing to vouch for me, and it's an easier path also. But the easier path wasn't the path that I think was meant for me, to be honest. So I decided to apply to some MFA programs with no art background, 0%, nothing besides, you go into the art museum with your friends and being like, oh, that's nice. No, I don't, like, I have no art history background. I took some art history classes in undergrad, nothing. I have my public health centric, like, paintings. And so I guess I should say, like, I mostly paint, and that's changing as well since I've been in school. A lot of my work, like, is me thinking of, or was me thinking of illustrative ways to talk about health behavior, to illustrate desperate impacts or desperate health outcomes, to illustrate, I'm trying to think of other pieces, to illustrate or to just conceptualize public health concepts, data analysis, um, thinking of systems in painting. And I love that. First of all, I love like the challenge that it presents to me. And I love that, like, in other places where I've been, things have like felt like work to me in a way that was not fulfilling. And me right now being in like my first semester of this of focusing on art is challenged me in a way that is fulfilling to me. Right, it's not necessarily like, oh, I don't have, this isn't a job, like this is super fun. It's not always fun, it's really not. It's like 50, it's not fun, but it's fulfilling, and it brings me peace, and it challenges me in a way that I love. So anyways, public health PhD was like, nah. And also it was too late for me to apply to a lot of PhDs. Like I decided to apply to programs super late. Again, shout out to my references, my mentors for like even like being my references, because I gave them like wild like 2 weeks, 3 weeks turnaround dates for like a reference letter for an MFA program. Like, wow, we love them. So yeah, and one of my references was my at the time my manager, my boss, at when I was a research project manager, project coordinator. So yeah, I decided to apply to some MFAs instead, or MFA instead, and not apply to any PhD programs. And I also decided that if I was gonna go back, this would be the last time I went back to school. This is no more letters behind my name. No more debt, no more FAFSA, no more. Yeah.
Okay, awesome, awesome. Well, thank you for sharing that journey and that thought process of getting to where you are right now. I think it's truly, truly fascinating, and I think it's awesome that you're also like embodying public health in your art and really bringing and embracing the challenge that all of that brings in expressing yourself. And yeah, I don't think like anything is enjoyable 100% of the time. There's always that percent that's like work, and you know, we got to get over those humps to get the satisfaction of the other things. But I think, as you said, it's so important that you feel fulfilled in what you're doing and the work, because I think at the end like that is what we're all searching for, that kind of fulfillment, and a lot of people don't find it. And as you said, you're thinking about this PhD, like maybe you went in the PhD route and then you're like, this is not for me, and you might have never found your fulfillment in the Masters of Fine Arts. So shout out to you for taking that jump, and also shout out for those recommendations for that 2 week
Yeah.
turnaround,
Yeah.
because that is wicked quick.
They're great people who really literally support me. So that's what's up. Shout out to all of them. I'm gonna email them.
Awesome. You got to share this interview with them when it comes out. That's for sure.
Yes, I will. Yeah, I will.
Awesome, awesome. So do you have a concentration, as well as did you have you said like when you were applying you didn't have any art pieces. So did you have to apply with like a portfolio or anything like that?
Yeah, so I had work. I had artwork. It was all in storage. I had work that I've been doing since I started in 2016. Um, so yeah, you have to. I had a portfolio that I submitted, and what you actually, yeah, I had a portfolio that I submitted, some of which again, if you like, were pieces that, yeah, I had a portfolio that I submitted, and you submit an artist statement, like your statement of interest or something like that, and then yeah, I think most art school processes are all the same. Yeah, so I did that. Did I get? Did I? I was like, did I get waitlisted? No, I had another interview about. I just wanted to interview professors. I'm sorry, I'm kind of doing a lot in my head. So yeah, portfolio, and writing materials. Let's just say that, and references. That was the three portions. So, and I also, this program that I'm in, I go to UIC, University of Illinois Chicago, doesn't have concentrations, but I applied solely using my paintings. And in my program, there are people, again, it doesn't have like a concentration like most MFA programs. So we've got a studio art, 3D art, other ones would be like multimedia, or like film or something like that, visual in that way, moving image. So this program technically doesn't have that, but people in my program do everything. And I even am now like moving away from painting into like doing more multimedia stuff. So like I've been working with different materials like outside of paint. So like I'm using CDs right now to do like mosaicing on like doors that I'm making. Um, I and using those kind of like sculptures and moving into like 3D art. Um, and also thinking about like using data, statistical programming as an art form, like using R, which I have a little bit of background in, um, using, I'm thinking about like moving into like visual arts, like moving image stuff, like doing film, as another way to kind of just figure out the best way to make the art do what it wants to do, or what am I trying to say? the best way for me and the best medium or materials for me to make something that I want to. And that's what this program is really about. It's like multidisciplinary in the art world sense. So sculpting, painting, film, et cetera, et cetera.
Okay, awesome. Thank you for sharing that and the process as well. Do you have like a link to a portfolio online that we could put in the show notes as well?
Yeah, I have my website, which is grossly under resourced, not under resourced, but under updated.
Mhm.
Yeah, I'll share my website, and I also post stuff on my social media too. I do like a lot of work in progress process stuff, showing process stuff on my social media, but I can definitely share my website and to y'all, and that's probably the cleanest place to see my work right now, and like my artist statement and stuff like that. So yeah, definitely that can do
Okay,
that.
awesome. Well, we'll definitely share that. And you do have like a couple weeks if you wanted to like up I guess get new stuff onto the website, but no pressure, no pressure at all.
Yeah, we're moving into final season, so I don't know if I'm gonna be able to. I probably won't, but
Yeah,
who knows?
and we're not going to hold it against you. That's absolutely fine. We understand. How long is the MFA program? Is it 2 years?
Yeah, so some MFAs are 2, some are 3. This one's 2 years. I think it's also this is a very public health centered podcast. So MFAs are considered like a terminal degree in the art world, like a PhD equivalent in pretty much every case. So that's also what I was doing in terms of like weighing the PhD versus the MFA. You don't get like you don't typically see, especially in the US context, like a PhD in art, you maybe like an art history or in like art education or something, but not in like art making. Yeah.
Okay, awesome. And then what are the aims of this with like your public health background and now trying to merge this with art and not just like painting? You said a lot of different multimedia art and trying to figure out what media is for you. So, and I guess in the larger high level scheme, what are the aims that you're trying to achieve with this MFA and your public health background as well?
Yeah, this is the the high stakes question that everyone asks in my favorite program. Like, what are you trying to do with your art? Like a super low, like mysterious tone. And right now, I have really leaned into exploration of having this huge, not huge, but having like a strong background in public health, theory and practice, and thinking of how to synthesize that into art making. And I'm gonna parse that out a little bit more into data and specifically um, thinking of methodologies and how different public health methodologies can go into art making and how art making itself is qualitative research and is a methodology or what I'm doing. Like I'm very stringent or like rigorous in my note taking and my documentation of my work, coming from again a public health like procedural background, and I'm also thinking really broadly about systems and specifically about Blackness, about race and ethnicity. And that's what something that was really sparked for me at my past job, thinking about how we are categorizing people and the implications that it has on every facet of life, census data, and that impacts funding and on how even me at my job surveying, having to subjectively categorize people or code people to a specific um, socially and politically constructed racial category and like what that does. Um, and how Blackness itself with data collection methods, with scientific methods impacts your health and well-being. So I'm doing a lot, and this is what every professor in my art program says, like, you're doing a lot, Derek. You're trying to handle a lot of things. And I'm like, I know. I know. That's why I'm here. I'm here to, parse this out and like figure out the best path for me to um maybe even ask the right questions, not even necessarily answer them. And this is how I know that I'm like a researcher to my depth. whether it's literally me doing research in like a public health setting or me doing research in an art setting. So my aims are to find out the right questions to ask in terms of specifically race, ethnicity, constructions, and even more specifically Blackness. And another aspect of that being categorizations in general in terms of like my queer identity and Black queerness. One, and then maybe the second biggest bucket being data and methods. And then the third biggest bucket being how do you synthesize that and communicate that in a way that people understand that all this is public health and all this is related to your health and your well-being.
Awesome. Well, I'm glad that you get to start sharing this on this platform, and because I think this is very fascinating, and it's not something that we hear about a lot. I don't even know if there are other people thinking about these kinds of things. So maybe like the Innovator, and I hope that this is your first podcast, or at least first public health podcast, so we can really just share that information. I think this is really, really fascinating, and it might like help other people just understand that there are so many ways and like different ways that you can impact public health and use the skills as a researcher to impact and show what is being done and how we can move forward to improve health and well-being for all people, and especially like those historically marginalized, disinvested communities. So thank you for this, and I definitely am going to follow along and see what this journey looks like, because I'm intrigued. That's for sure.
Thank you. Yeah, this is a really great opportunity. Like I so appreciate like you reaching out to me about this. This is like the first time I've done a podcast. And it's funny that I'm not technically in a public health space anymore doing this, but public health is such a huge part of me, and will always be. Like these skills are forever and translatable, even though difficult in translating sometimes. But I really appreciate this opportunity and being able to like even like talk through this, and again like practice even like this translation of art talk into a public health space. Like this is great.
Thank you. My pleasure, absolutely. I really appreciate the vulnerability as well. Anyway, moving on to the five questions that I ask all guests. So number one, what advice would you give to students trying to pursue a career in public health or in public health / art?
Follow what you're interested in, whether that be one thing or it be 5 million things, maybe not 5 million, but I think follow your interests, explore. Don't be afraid. Don't be afraid to explore your interests, whether it be something you have experience in or not.
Awesome. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
What position am I in?
MFA candidate.
I would say advice. You know what? Self-discipline, I think, is like super important. So my advice would be to, in whatever capacities you can, to continue to build, if you don't already, build your self-discipline. I think it's something I'm working on today that will help you in life. It's a life skill, regardless. If you want to do your MFA or do your PhD or be a director of a health department, you have to have self-discipline to be there, and to juggle these big things, even just being a MFA candidate.
Absolutely agree. Number three, what's something you are working on improving in your life right now?
Can I just say self-discipline? Like really, I think specifically documenting my self-discipline. I take research methods with me everywhere. So yeah, just self-discipline in general. Building daily practices is something I'm working on improving in my life right now.
Okay, awesome. Number four, professionally, do you recommend anything?
This goes back to my something I said earlier, but I recommend asking questions and reaching out to people respectfully. I think that is huge, in terms of specific like resources or like books or something. You know what? That's the thing. I would say I think this is a weird thing to say, but like, or maybe underrated, or I don't know, but like reading, like try to read more. I think one thing I've done in the past year is just carve out time to like literally 20 minutes, 30 minutes in the morning and at night just to read, whether it be a book or a research paper or a specific article or something, like just other than like social media, like other than like a Twitter or something. Just like that for me has been so helpful in expanding my horizons and parsing out thoughts and things going on in my head. So I'm just gonna say reading. It's
Yeah,
fundamental.
yeah, awesome. It is very fundamental, and I agree. And then last but not least, where can people connect with you?
Yeah, so you can connect with me in social media. You can, that my email is connected to that. My social media is all the Danthology. So I'm just gonna spell it THEDANTHOLOGY. That's my website too. I think if you look up my name, like Derek Holland, there will be a whole bunch of baseball players that come up. So don't do that. Oh yeah, my social media, which I guess we'll share somewhere, is probably the best way to connect with me. And then my email is connected to my social media, and my website is the same, thedanthology.com.
Okay, awesome. And that would be like right under you in the video. So anyone who's watching the video can see that, but you're also going to see it in the description as well, as if you go to the show notes. So definitely check that out. But thank you so much, Derek, for coming on. I really, really appreciate you coming on and sharing your story. Very unique, very vulnerable. And I think it's going to be very helpful. And I hope that this is the start of your trajectory to really do some really different, great work in public health and arts. And I look forward to seeing what that journey really looks like for you, because I'm very intrigued, very, very intrigued.
Thank you. Thank you so much. I appreciate this a lot. Really.
My pleasure. And then housekeeping items, everyone. Thank you so much for watching. Be sure to subscribe, to like, to leave a review. If you have not shared this with a friend, I greatly appreciate it if you do that. And if you want to support, you can go to buymeacoffee.com/the PH Millennial, or you can go to the phmillennial.com/supports. I think that's a link and you can support there. But peace out. See you all next week.